Everybody, this is Dr. Minich. I'm here to talk with you more about the seminar that I'm going to be doing in South Africa on June 21st and June 22nd. The title of this seminar is Personalized Functional and Lifestyle Medicine Approaches to Cancer Prevention and Treatment. This is a hot topic. Many of you know somebody who had cancer yourselves. I'm sure just about everybody listening would answer that they have. So this seminar is going to be very instrumental for helping you to understand how do you take a full comprehensive view nutritionally and from a lifestyle medicine point of view to both cancer prevention and treatment. And it's probably the cancer treatment side that you haven't heard a whole lot about as it relates to nutrition and wellness and what to do there. Many practitioners find it difficult to navigate the science and understand what exactly they need to do for patients that are experiencing different types of treatment. So let me just tell you a little bit about me. I've been to South Africa before, back in 2011, and I met a number of you then. So I hope that I'll see you again. And if I haven't met you, I very much look forward to meeting you. So that you know who I am specifically, let me just give you just a couple of bullets on myself. My approach to medicine is very, very grounded in functional medicine and lifestyle medicine. So I have my own practice, which I call Food and Spirit, and Food and Spirit is very broad when it comes to really focusing on all the facets of a patient. So looking at their nutritional status, looking at their emotions, their thought patterns, what they need in terms of mind-body practices. So I have a whole system where I've looked at 7 different aspects of people's lifestyle and then anchoring those into the treatment modalities. That's more or less my mindset, and it gives us a nice framework to move forward. Now, throughout the past years, I have done a lot with functional medicine. I was Vice President of Scientific Affairs at Metagenics. I worked there with Dr. Jeffrey Band for a decade. And now, within the past 2 years, I've been very active working with the Institute for Functional Medicine. So working on their curriculum, I'm also faculty for them. I have been faculty for the past, this will be the 2nd year now, on the detoxification module. So I teach detoxification, I teach the food system there, and also different mind-body strategies to help with people going through a detox. And we're going to talk much more about detoxification when I'm actually there in person. Lots of exciting things happening on the horizon as it relates to detox. So I work for the Institute for Functional Medicine. I also work with Dr. Jeffrey Bland at a new institute that we call the Personalized Lifestyle Medicine Institute. So there's a newer institute that has been birthed, and it's a little bit different than the Institute for Functional Medicine because we focus on the whole aspect of personalization. In fact, of course, within functional medicine you see that as well. But now how do we personalize all aspects of the patient's modalities, not just the food, not just the supplements, but can we personalize things like exercise, physical activity, and even mind-body medicine practices? So I will bring forth some of the science that we have on that. I'm also a lecturer at a cancer retreat center here in Washington State in the United States where I live. It's called Harmony Hill Retreat Center. And so every month I go in and talk with cancer patients about different things that they can do from a nutritional standpoint. So I do focus very strongly, and I've been doing that for about 5 years. I encourage much of my training in functional medicine, my training in supplements, and going back to even graduate school, I have had the experience and pleasure of working with Dr. Bach. Bach and also and others that work in the area of cancer. Dr. Keith Block is another person that I've worked with, and Dr. Keith Block is in Chicago, and he's done tremendous research on different strategies, integrative strategies, to help people with cancer go through cancer treatment and therapy as much as preventing cancer. So really my training in cancer and modalities goes way back, and it's really from the aspect of research and then has morphed now into doing more clinical application. And then I finally mentioned that I'm also a professor at two different universities currently. I teach as part of the Maryland University Integrative Health program, as well as the graduate program at the University of Western States, which is a master's program in functional medicine and human nutrition. So what you're going to get from me, based on my experience, is I'm a hybrid scientist with a clinician, and the science precedes my clinical training. So I'm always coming from the place of science when I'm talking with you about clinical application. Why would you attend this seminar? What are some questions that you might want to have answered? So here are some questions, the top 3 questions that I'm thinking based on what I know about the seminar and what I'll be presenting. So if you yourself are concerned about cancer, maybe you're concerned about cancer incidents in your patients, in your own family history, what I have found many times is that people attend seminars to also get personal knowledge, and that's fine too, because cancer it's a disease that has a lot of fear around it, a lot of emotion. 1 in 6 people have some form of cancer or will get some form of cancer. So it's definitely something that we have to keep on our radar, both personally and professionally. The other question to ask is whether or not you are really tuned in and wanting to get the latest science on just modalities, but also mechanisms as they relate to cancer. So looking at cancer medical practices. And I'm going to tell you a little bit about the meetings that I've been to lately, different professional colleagues I have, and why that's relevant for this question. You know, really bringing in the new information. I think that's important. You know, we've got to go beyond, this is the 21st century. Things have changed since we cracked the genome in 2003. And so a lot of things are happening, especially on the oncology front, that I want to talk with you about. So I'm very science-driven. So, and what I try to do is not bog you down so much in the science, and we have just, one short day together, but really take it to the high level, distill it down, because I bet many of you as clinicians, you don't have time to be spending on Medline and looking through research abstracts. So let me do that work, pull it together for you, and then make sense of that clinically. Anyway, if you're wondering, on the treatment side, on the modality side, how do you actually personalize an approach to cancer? Not all cancers, they're extremely different. And even within one patient, they can have different types of cancers that need to be addressed differently. And what do you do with drug-nutrient interactions? And how do you support people going through chemotherapy and radiation? What are the different types of cancer? How do you work with liver cancer differently from gastric cancer when it comes to nutrition? These are all the questions that are in my mind, and this is what I'm hoping to address within the seminar. So if one of these 3 tickle your intellect and interest, I would strongly advise that you sign up for the seminar. It's going to be an excellent use of your time. I am an information-packed presenter. I love to give lots of information, tools, and it's going to be very engaging. It'll be a bit, I'd say, a bit fast-paced in the way of being information board readily. So if you're coming in with an understanding of functional medicine, and I know that the South African audience is very advanced in many ways, we are going to pick up where we left off with functional medicine. This is not going to be a functional medicine 101. This is going to be utilizing the principles of functional medicine to take you to the next level in cancer. So I'd like you just to look at these slides. Now we're going to shift from left brain over to right brain a bit. And of course, what I start out saying is oh so true in terms of our experience with cancer, that all of us to some extent have had some experience either personally or somebody close in our environment with cancer. So I happen to find this series of pictures that I'm going to show you. So again, just to kind of be in the spirit of observing these pictures as we go through. This is a husband and wife. This is a couple. And he documented her through breast cancer. So she had breast cancer very early on, and you can see how things happen. So I'm just going to flip through each of these rather quickly just so you get a sense of just a journey that we move through when we are in the midst of cancer, right? And I see all the time when I'm working with patients on a monthly basis. I see it with my own family members. I've seen it with other patients. The pain, the agony, the emotional trauma, which is not just for the patient themselves, but also for them. And gosh, there are so many options. And how do we bring our patients forth into these options, right, so that we don't have a short lifespan, but a quality lifespan? So these pictures to me are just so poignant. They're so pivotal. They really do represent much of the fear and the experience of what most people know of as cancer, right? But I think that we can be beyond this. I think that there are ways that you can patient. So of course this story doesn't necessarily have quite a happy ending. You can see this woman's goals, her family, she's changed dramatically. She's really going through the process, treatment, and how treatment just changes us. It really pulls us into that space of crisis, right, in terms of really evaluating everything. So I know the realistic aspect of cancer, to relook at how the trajectory can go. I believe, again, that we can take that emotion and funnel that into clinical and science-based strategies to help people. This is different. When my grandmother was going through cancer in the early 1980s, things were so cookbook then. They were just like I was showing you these pictures. You kind of go through the course, you go through chemo and radiation, and still that's in play. We still have modalities that can be effective for certain cancers, and we're going to talk about how do we complement therapies now with what we know in the 21st century, which is quite different than when my grandmother went through bone and breast cancer in the early 1980s. Very, very different. So we're going to pull them together. Even now, more than ever, there's much more hope for people with cancer. I happen to live in a certain part of the United States where there are a number of research universities and hospitals that are taking completely different approaches to cancer and targeting drugs, making them much more effective. So when you approach when you first come into the seminar, you're going to notice that the first hour we're going to dive into mechanisms, because I believe that if you don't understand why cancer happens, then you understand the rationale for treatment and how we're going to move along the trajectory. So we just have to start to understand what is known about cancer. And I just happened to be traveling through the airport about a month ago and stopped in a newsstand store and found this Newsweek journal. And on the front cover it shows, "Solving Cancer. You can't cure what you don't understand." And then it says at the bottom, "In the war against cancer, the enemy remains poorly defined." Well, I think that that's the case with certain paradigms of how we view cancer. Perhaps we have to work with cancer in different ways that we have not worked with cancer before. In other words, if we always do what we've always done, we're always going to get what we've always gotten, right? That's from Dr. Seuss. It's not even a scientific tenet. That's just basic, just common sense, right? So perhaps we need to work with cancer in different ways. We need to understand it with different eyes and different paradigms. Just a couple of weeks ago, on April 11th, at a meeting at the Institute for Systems Biology here in Seattle. And I went to a meeting. This was an international symposium with lots of researchers and some clinicians talking about how to look at cancer in different ways, looking at it from a systems biology point of view. And as the flyer says here, the pamphlet, from big data to personalized treatment. And I would tell you that I've really had the pleasure of talking with gurus in this field like Dr. Leroy Hood, who is the founder of P4 Medicine, looking at personalized medicine. And what he is showing is that there are markers that appear in the blood before somebody gets cancer that we can be detecting very clinically. So this is emerging science. This is not what we're going to be able to drill into to any great extent, but I want to lay this as a groundwork for you to know that I have not seen as much in the way of full running developments in the worlds of science and clinical application for any other field of medicine more than perhaps it's the meetings that I've been at. I was at the Personalized Medicine World Conference in January with Dr. Band. Personalized medicine is going down the trajectory of focusing on cancer. Let's zoom in rather than zooming out like we just did, looking overall, but zooming in and looking at what are the seminar components. We have 4 sessions at 90 minutes each, focusing on different topics and really having that dedicated time to drill into those topics. So the first hour and a half, we are going to focus on the mechanisms of cancer, how to understand the mechanisms, what are the different ones that are at play. And so that's where, again, I'm going to put it within a system. So it doesn't just become a whole lot of science without any context. I'm a very systematized thinker. So you're going to have a framework to plop a lot of this knowledge about mechanisms into. Then the next hour and a half, we're going to focus on the science of lifestyle medicine approaches. And we're going to take it from nutrition, emotions, stress modulation, and toxins. Those are the key areas. So we're focused on the science. Is there science to support use of, for example, physical activity when somebody's undergoing chemotherapy? Is that a good thing? Is that a bad thing? So we will talk about that. And then the third hour and a half, we are going to focus on cancer prevention. Spend a lot on cancer prevention. So how do you work through it all and make sense of it? How to distill it down? And sometimes that's where it becomes very overwhelming. Let me do that for you. Let me give you the guidance and the support that you need in order to make their clinical treatments and also treatment options for your patients based on the newer research that's out there. And then the fourth and final hour and a half that we will have together is probably the area that's most controversial. So this is where not a lot of people like to go into this, right? The whole idea of cancer treatment, what do you do? And I can see it every time I go and work with the cancer patients at the retreat center. The physician has told them to do X, Y, and Z. And we talk about that. Do they do soy or do they not do soy? What about flax? What about supplements? What about fish oil? Should they be doing probiotics? There are 1,000,001 questions. What about sugar? What should they be eating overall when they're going through cancer treatment? Does that even make a difference? What about sleep patterns? As you could see, the list goes on and on and on. Again, I gather those questions from real patients that have these concerns and don't feel like they're actually getting that support from their practitioners. They need answers too. So our cascade will be moving from the why, looking at the mechanisms. We'll look at the facts within the science. Then we'll close with the how, looking at cancer prevention and cancer treatment. Now, when we focus on the different types of mechanisms that are at work, the framework that we will choose is 7 different areas. So I'll take you through each of them. Fashion and defense, fluid and flux, digestion and assimilation, oxygenation, mitochondrial resuscitation, and dysfunction is at the heart of so much of the cancer processes and keeping it going. I can't talk about that. There's so much in the area of mitochondrial health to cover. Metabolism, integration, that brings in insulin resistance, cortisol. How do these things bring into cancer things like the oncometabolic potential? Metabolism so front and center in the cancer research. We're going to talk about that in some of the latest studies. Question and communication, so looking at hormones. And, of course, one of my favorites, detoxification and purification. Why is cancer on the rise? Well, perhaps it has something to do with the increase of environment. It's staggering if you think about it. It was estimated not too long ago that the average adult at any given moment has about 700 different contaminants in their bodies. At birth, we have over 200. So toxic at birth, and the toxins toxicity keeps increasing. So we definitely have to make that a focal point as clinicians. So we are going to definitely connect personalization to lifestyle medicine and really make sure that you can see the bridge between the two. How do you make the translation clinically? As we hear here, this is the researchers from Harvard, personalized medicine is center stage in cancer. In fact, again, I don't see it anywhere else in oncology. It is the future of cancer. It absolutely has to be that way. So I think that one of the reasons why the war on cancer, which started in 1971, especially in the United States, when we had a whole presidential campaign around the war on cancer, why has it not been successful? We're going to talk about that. Are we moving uphill, or are we just not seeing certain things on either side of us? And I think that part of this is really to the acknowledgement of the different mechanisms, looking at cancer not as one big lump, literally, but also as a dynamic web and interplay amongst the systems. So the complexity of that disturbance amongst the systems may result in progression towards cancer, right, and proliferative cancer. So we're going to talk about that, definitely. And I'm sure that many of you that are oncologists are working in this area already. You can already see that there are changes happening at the molecular level. So now, especially in research hospitals, what we're seeing is that oncologists are looking to segment different types of cancer. And, this came out, this quote saying that breast cancer isn't one disease. It's a multitude of diseases, and it's so different depending on the patient. What we're looking at here, as Dr. Bland would even call it, we're looking at cancer as an altered orchestration of functional physiology. How do we get the environmental signals to be in sync with our physiology? And the outer environments are in balance, are in tandem. So we're going to talk about personalized medicine. Personalized medicine is different than personalized lifestyle medicine, of course. It's more focused on pharmaceuticals and how do we personalize the different pharmaceuticals to the different cancer types. It's very exciting because what I'm seeing even in the medical journals now is that there is much more crosstalk between pharmacists. I hope that pharmacists, if you're listening, that you attend because we conversation between the pharmacists and the physicians. Because now look at this ad. Essentially, this tool, this diagnostic tool, manages genetic profiles with medications that are most often prescribed for a number of different conditions. Cancer is among them. In fact, a lot of the technologies are taking visual snapshots of the cancer and then essentially using that to determine the best course of treatment. So I think it's exciting. I think we're on the verge. We're all fortunate enough to be part of that movement. So we talk about oncogenic potential. We won't go into everything that's on the slide. You're going to hear much more about it. But what is oncogenic potential? What is oncometabolic potential? And how does, again, insulin, cortisol, metabolism play in? We're going to drill down, as I mentioned, into lifestyle medicine. Because the reason why we need to focus not just on food but on a comprehensive approach is because 85% of all cancers result from environmental risk factors, everything from diet to smoking to physical activity or inactivity, toxins in our environment. And that's really a phenomenal number to think that most cancers, the majority, have some lifestyle medicine component involved. So the science is telling us that, tobacco use, diet, obesity, infections, genes are really a small percentage. We have to acknowledge them. It's very, but then genes. In fact, if you look at Dr. Ornish's trial, and I'm going to take you through this much more in depth. This is just a quick overview so you can see some of the nuggets. And really, this is just little. This is like the tip of the iceberg. There's so much there that we're going to cover. But Dr. Ornish on prostate cancer, and he took men took 10, put them on lifestyle change, took 25, had no lifestyle change, and then you can see the difference between telomere length. Telomeres are connected to cancer risk. So as we get shorter and shorter telomeres, we start seeing an increased cancer risk. And he was actually able to not just stop the telomeres from shortening, but to improve the length through lifestyle. You might think when they think of genetics, they might think of Angelina Jolie, Barack Obama, and how they interrelate with cancer incidence. Now, I have to bring this up before we dive into our seminar because you're going to find this very intriguing. Mary King is the researcher that was part of the identification of BRCA1 and BRCA2. These are genes that are connected to breast and ovarian cancer. And essentially, as we can see from this article in Science in 2003, states that the lifetime risk of breast cancer among female mutation carriers is presently 82%, meaning that if you have these genes, there is a great chance that you may get breast cancer, 82%. But when these genes were first identified before, way back, before 1940, it was 24%. So the genes haven't changed. Our environment has changed, whether it's greater obesity, less physical activity, and modulating factors that have changed that around. So I think that is really crucial because I know that some of you are going to ask about certain genetics and the interplay with cancer. So we will get into this because there are fascinating studies with twins, and sometimes you just don't know unless you're looking at the same genetics and applying different lifestyles on top of that. So we will get into lifestyle habits that are associated with cancer. We will talk about the overarching personalized lifestyle medicine principles, how to utilize these principles in oncology. It comes into, again, creating a therapeutic intervention. Things that we'll talk about when we talk therapeutics is all the different facets that go into a personalized approach and what that means. And that does include the genetics and mutations as much as the environmental factors. And one of the things that I'm very passionate about is single nucleotide polymorphisms. So the gene variants that we might have and how we might be able to override those with nutrition and or lifestyle intervention. So we'll talk about things like methylation. So when it comes to a personal lifestyle medicine assessment, we're going to go deep into this, looking at the cancer stage, looking at the lifestyle medicine assessment, and I'll show you different tools that you can utilize to track these measures, and of course using the functional medicine matrix along with a variety of different labs, biomarkers, and SNP analyses. Now, the way that I will focus our therapeutic essentials discussion is within this same pinwheel. We move through things like nutrition and supplements, and that's where a lot of our energy will be spent because that's my training and that's my expertise with cancer. We will also dive into emotions and a number of opportunities to really dive into things like emotions, thoughts, and stress because they tie so much into nutrition. How people eat is how people live, and how people live is how they eat. So there's so much intertwined web-like activity here. We'll also talk about physical activity, affirmations, visualization with Dr. Keith Block in Chicago and did research on his cancer patients. What we found was that visualizing what we want as our health outcome, one of the most potent predictors of people improving their quality of life. So these mind-body strategies, this is great, and so we'll bring that to the forefront as we talk about the therapeutic essentials. So we'll move through the therapeutic essentials with the Cancer Prevention Core Program. So we're going to present a basic core for everybody, but of course, as we dive into the different types, to personalize that. Well, as I mentioned, assessment and treatment, if people do have cancer, or if they've had cancer and then be cancer again. So I think that this is going to be exciting. I'm really enthused to be able to share this information with you, to meet you, to hear about your concerns, your questions, and I'll do my best to provide exactly what I know with respect to the science all the meetings and conversations and colleagues, all of their wisdom that I've been interacting with for the past years, as well as my patient experience working with cancer patients on a monthly basis and really being in the trenches with their questions they want to know. I hope to see you at the seminar. It's June 21st in Johannesburg and June 22nd in Cape Town. And it goes from 8:30 to 4:30, and you definitely want to book as soon as you can. So hope to see you there. It'll be delightful to come together. Much.